overnight, swift reaction to blunt testimony from several of the nation's top doctors who told the Senate in no uncertain terms reopening the country too quickly could cost more lives.
There is a real risk that you will trigger an outbreak that you may not be able to control.
The president's son-in-law and top advisor Jared Kushner in an interview with Time magazine acknowledging there is some risk in reopening.
There's risk to anything, but the president carries the burden of the 30 million Americans who have lost their jobs due to this historic effort to save lives.
Dr. Fauci and 3 other top health officials testifying remotely Tuesday before a key Senate committee, making it clear while there has been progress, the virus is still dangerous.
Do we have the coronavirus contained?
It depends on what you mean by containment. If you think that we have it completely under control, we don't.
There was also bipartisan agreement more testing is needed.
What our country has done so far on testing is impressive, but not nearly enough.
Republican Senator Mitt Romney blasting President Trump's declaration that his administration has prevailed on the issue of testing, with more than 9 million tests nationwide.
I find our testing record nothing to celebrate whatsoever.
With a staggering 80,000 deaths so far from coronavirus, Dr. Fauci admitting it may be even worse.
But most of us feel that the number of deaths are likely higher than that number.
And Fauci also said it was unlikely there will be a vaccine available by the fall to facilitate students returning to school, prompting this retort from Senator Rand Paul.
As much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy.
I've never made myself out to be the end all and only voice in this. I don't give advice about economic things. I don't give advice about anything other than public health.
And overnight, that interview you saw with the president's son-in-law, Jared Kushner, raised eyebrows when Kushner was asked by Time if there was a chance the presidential election could be postponed due to the pandemic. Kushner said it isn't his decision and that he cannot commit one way or another, adding the plan is to hold it on November 3rd. Aiming to clarify, Kushner released a statement overnight, quote, "I have not been involved in nor am I aware of any discussions about trying to change the date of the presidential election. It is worth noting Election Day is set by federal law and requires an act of Congress to change it." Hoda, Savannah?
All right, Kristen, thank you. And adding to the concerns over the country's reopening this morning, that unreleased White House report that shows where new hotspots for the virus are emerging. And this is happening as cities are taking different approaches to how and when they should move forward. NBC's Tom Costello has that angle of the story this morning. Tom, good morning.
Hi, Savannah. Yeah, a lot of moving pieces here. As you know, governors in some cases are leaving it up to local communities to decide how and when they lift restrictions. Here in the nation's capital, we're set to see the restrictions expire in D.C. on Friday, but now that's expected to be extended. Northern Virginia, just across the river, already extended all the way through the end of May. And in California, it's going to be a lot longer than that. Through mid-August at least. That's how long stay-at-home orders could be extended in Los Angeles, according to the L.A. County Public Health Director.
We know with all certainty that we would be extending health officer orders for the next 3 months. L.A.'s mayor later clarifying those comments, saying restrictions across the region will be lifted gradually.
Dr. Ferrer merely said that an order would stay in place for at least 3 more months. That doesn't mean the order stays in place exactly as it is today.
Meanwhile, across the country in New York City, news that the iconic lights of Broadway are now expected to remain dark through at least Labor Day, with theaters offering refunds and exchanges for the roughly 2 million tickets purchased for shows through September 6th. And while much of the focus surrounding coronavirus has been on big cities, new infections suggest a shift in the outbreak from major coastal communities to the country's heartland. An unpublished coronavirus task force report obtained by NBC News shows the top 10 areas with the largest week-over-week increase in cases throughout the central and southern regions. Among them, Nashville, Tennessee.
Redneck Riviera is now open for business.
Music City's iconic downtown opening its doors with some restrictions. Country singer-songwriter John Rich among those excited to welcome back patrons to his bar.
It's a big thing because you can finally get back to a beginning semblance of normality.
Georgia, which faced criticism for early plans to reopen businesses like tattoo shops and massage parlors, now pushing the brakes. The governor extending restrictions on bars, nightclubs, and performance venues through the end of May.
We believe that waiting a little bit longer will enhance health outcomes and give folks the opportunity to prepare for safe reopening in the near future.
And Tom, let's go back to California. We mentioned the country's largest public university system, Cal State, has decided not to reopen campus and just move classes online this fall. Yeah. What do you think that means, in terms of a signal for other universities around the country?
Well, it certainly could be a precedent. Now, separately, the University of California system says it's going to decide this summer. But the Cal State system, as you know, is 500,000 people, 23 campuses. It says it's been losing hundreds of millions of dollars because students are not on campus. But universities across the country are really wrestling with this. Here in the Northeast, Brown University, its president has said that really, it should be a national priority to reopen the universities nationwide. Up in Canada, McGill University has decided it's going to go to online learning in the fall. Universities up and down are struggling with when they should reopen and how good of an education are they providing if it's online. I got to tell you, I've got 2 university students, and they've been dealing with this as well. It's not an easy one.
No, universities wrestling with what cities and states and the whole country is wrestling with this difficult decision. Tom, thank you so much. Almost 10 minutes after the hour, I'll send it back to you, Hoda.
All right. Thank you, Savannah. Now to growing concern over the coronavirus's impact on children as doctors report more cases of that mysterious and rare illness with likely ties to COVID-19. NBC's Kristen Dahlgren joins us with the latest developments here. Hey, Kristen, good morning.
Good morning, Hoda. Well, one of those new studies from Children's National shows that 1 in 4 children who tested positive had to be hospitalized. Of those, nearly 40% had no pre-existing conditions. And this morning, we're also learning about new cases of that inflammatory syndrome affecting kids.
Scientists have shown that
the nation's top coronavirus expert at a Senate hearing Tuesday, with a warning about the assumption children aren't severely impacted by COVID-19.
We don't know everything about this virus, and we really better be very careful, particularly when it comes to children. Well, right now, children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome.
Pediatric multisystem inflammatory syndrome, or PIMS, is rare, but making some children very sick. While new research also shows some children with COVID-19 are presenting with severe respiratory or gastrointestinal symptoms.
I think it's really early to know how different or similar this is going to turn out to be in children versus adults, but we know for sure that children are developing 2 separate kinds of diseases from COVID.
The immune response symptoms can include high fever, rash, abdominal pain, and the inflammation can attack organs like the heart or kidneys. At least 3 children have died, and cases in infants to teenagers are now suspected in at least 14 states. New York alone has 100 cases.
It's probably in other states and probably hasn't been diagnosed yet in other states because, again, these children don't present the usual COVID symptoms.
There are treatments that seem to be working. We first introduced you to Jaden Hardawar last week when he was still in intensive care at New York's Cohen Children's Medical Center. The 8-year-old went into cardiac arrest, never even knowing he had coronavirus. On Tuesday, Jaden went home to a standing ovation from first responders.
So there is optimism, especially if it's caught early. And by tomorrow, the CDC says that it hopes to send guidance to doctors nationwide to help them identify and track cases. Savannah.
All right, Kristen, thank you so much. Let's turn to Dr. Scott Gottlieb. He's the former head of the FDA, now a CNBC contributor. Dr. Gottlieb, good morning. There's so many moving parts here, and I want to talk about kids and coronavirus in a moment. But first, let's throw up that map that was in that White House document that hadn't been released yet, and it really shows a spike now in Middle America. I mean, do you have any insight into why that might be and what that possibly portends?
Look, we're seeing some hot spots regionally in states that were largely unaffected or not as affected as the New York region, for instance. When you look across the country nationally, you're seeing hospitalizations still go up slightly. Maybe there's been a flattening over the last week, and cases still continue to expand. Now, some of that's an artifact of the fact that we're testing more, so we're capturing more cases nationally. But the hospitalizations still appear to be going up. So this is an epidemic that hasn't run its course nationally and hasn't really started to show sustained declines outside of the New York region. So we're reopening against that backdrop, and you're going to start to see spikes of infections in parts of the country that have been largely unaffected up until this point.
Well, you know, we talked about the university system, whether it's cities or states. I mean, it's such a tricky question about how much you can reopen, when you can reopen, trying to stem the tide of, you know, you're going to see a rise in cases, but you don't want an outbreak that gets out of control. I mean, how do you analyze whether or not it's safely being done right now?
Look, there's a lot of economic hardship on the other side of this. Keeping the country shut down is causing economic pain, and that economic pain is translating into public health impacts. People missing appointments, vaccination rates are down by about 90%, prescriptions for vaccinations. So it's very hard to continue to keep the country closed. We thought when we were reopening in May, and we always expected to start reopening in May, we'd be reopening against the backdrop of less spread. There's a way to do this safely. You do it slowly. You reopen more essential businesses first. You make sure workers and people have proper protective equipment in the workplace. People who are at risk work on the shop floor or in factories, things like that. You take pauses in between as you reopen the economy in a staged fashion to see if there's going to be a spike in new cases or hospitalizations. You don't open things where people congregate indoors right away. Things like bars and restaurants are going to have to stay closed a little bit longer. You try to move services outside rather than have them inside because we know there's less risk of transmission when things are held outdoors. So there's ways to do this safely, but make no mistake, as we reopen the country, we're going to see an uptick in cases. We always expected that. The only difference now is that we're reopening against the backdrop of more spread than what we expected. We thought we'd be seeing more sustained declines in new cases. And so that ups the risk that what you end up happening is a surge in cases or a slow burn through the entire summer where we never really get rid of all this background infection and we go into the fall with more risk.
Let's talk about kids and coronavirus. I mean, this is so disturbing for so many parents who, you know, for a time, I think, you know, a lot of us were like, oh, great, you know, coronavirus is not affecting children as much. And now we're hearing about this this condition that may or may not be related to COVID-19. Are you surprised we don't know more at this point? And we have 1.4 million cases in the U.S. Are you surprised we don't just know more about the virus now?
We've been learning a lot about this virus as we go. I'm surprised we don't have more systematic information being put out by authorities like the CDC, given the fact that we've had 1.4 million cases and hundreds of thousands of hospitalizations. You'd want to start seeing data on the collected experience of patients in the United States. A lot of the information we have is coming out of China or Europe. This condition that kids seem to be getting seems very concerning. There was a perception that coronavirus was a largely benign affair in children. That's not the case. When you look at even the data in New York City, where you had 300 hospitalizations of children under the age of 17 and 9 deaths, that's a lot. That's a lot of death and disease, even relative to what happens in with the flu season in New York State and New York City each year. So coronavirus isn't a benign condition in kids. What we don't understand is the denominator. We don't know how many kids are getting coronavirus. And so if we have these 50 cases of this inflammatory condition, this sort of post-viral condition in New York City, for example, which seems to be the case right now based on the mayor's reports, how many kids actually had the virus? Was it just thousands or over hundreds of thousands of kids had the virus nationally? We don't know the answer to that question. There's going to be a study that's going to help us answer that question. There was one good study in Science magazine about 2 weeks ago that said that kids are about a third as susceptible to coronavirus as adults. So what the study basically concluded, and this was data out of China, is kids are getting the virus, but they're less susceptible to the virus, so they're getting it at a lower rate than adults would. And so that suggests that there are probably a lot of kids that are getting infected with coronavirus, but most of them are having benign courses. It's subclinical. We're not really detecting it. But we need to figure out what that denominator is, how many kids actually had coronavirus.
Yeah, important questions. Hopefully we'll be starting to get the answers to those, Dr.